A 2-month-old girl is brought to the office by her parents for a well-child visit. She is exclusively breastfed and takes vitamin D supplements. The patient is able to lift her head when prone and smiles socially. She lives at home with her mother, father, and grandmother. The father occasionally smokes cigarettes, but never in the presence of the child. The grandmother often helps take care of the child overnight and sleeps in the bed with her. Physical examination results are appropriate for age. The child is due for several routine vaccinations today. The mother becomes tearful and mentions that the patient's 3-month-old cousin recently died in his crib and the cause remains unexplained after autopsy. She asks for information about how to prevent such an incident. What do you answer? Sudden infant death syndrome (SIDS) is the leading cause of mortality in infants aged 1 month to 1 year in the United States. It is defined as a sudden, unexpected death that cannot be explained by history or post-mortem examination. For example, investigation of the scene or autopsy. Sleep position is an important modifiable risk factor for SIDS prevention. In 1992, the American Academy of Pediatrics recommended that infants be placed in a supine position while sleeping back to sleep campaign to reduce the risk of SIDS. This measure proved to be highly effective, resulting in a dramatic decline of SIDS in the United States. Other factors associated with a decreased rate of SIDS include limiting prenatal and postnatal smoke exposure, pacifier use during sleep, and room sharing without bed sharing with a caretaker. Bed sharing with parents and siblings is generally discouraged, especially when parents smoke in bed or use a substance that may impair alertness, for example, alcohol or illicit drugs. Due to the risk of suffocation, soft mattresses, crib bumpers, and loose bedding are discouraged as well. SIDS is not associated with administration of any vaccinations. Routine vaccinations are recommended and can potentially lower the risk of SIDS. Although prone positioning is the strongest associated risk factor for SIDS, the side sleep position is a greater risk factor than the supine position. This is likely secondary to an increased ability to roll into the prone position. Home apnea monitors are not recommended. Even if an infant has non-modifiable risk factors, for example, sibling with SIDS due to lack of evidence of their benefit,